Okay, I just started watching something, and I'd confess that I watched like maybe 6 7 seconds of it, and I thought I should probably react to it. Again, this is what you see on your screen. That is true cost of U.S. healthcare and how it's shocking the British public. So I don't really have a dog in this fight. I just want to see how someone in the UK reacts to medical expenditure in the US. I know, full disclaimer, I do understand the systems a little bit. Um, I think UK works on NHS because some of my friends are in the UK, Britain, and they tell me about the NHS. Mostly good stuff, but not all good. Not everything is good about it as well. They have some criticisms as well. Again, nothing's perfect. And I have a ton of friends in the US, and they have their perspective. Not all of them are critical about the US system, and some of them have legitimate reasons. So anyway, with that behind us, let's just get to the video and see what people in the UK have to say about medical expenses in the US. All right, let's start. Wait, what happened to the sound?
10 grand for a baby.
Is there
Wait,
For a baby.
is there a price for that?
Yes,
Jeez, $100, $100.
$2.5 grand.
$80.
600.
250.
More.
Shh.
EpiPen.
Shut the fridge.
More.
£300.
Double it.
$600. $600.
Okay, she oscillates between different currencies here, but okay, $600 is still quite high. Quite high.
Yeah. Ambulance call out. How much do you think that costs?
Zero payment.
Zero payment.
Yeah, zero payment.
No.
Calling
It costs
ambulance.
$2,500.
For real?
Yeah.
Okay, cool.
You look.
Is
Inhaler.
pretty cool about it.
$100.
Yeah, you're pretty close. It's a bit more.
120.
250
what?
to 350.
What was it?
For an inhaler.
Yeah, you're pretty close.
So I have to keep the volume down because it's late at night and people in my home are sleeping. I don't want to wake them up, so I hope you understand. Anyway, what was that?
You look. An inhaler.
Inhaler.
$100.
Yeah, you're pretty close. It's a bit more.
120.
250 to 350.
For an inhaler.
Yes.
Man. So if you're poor, you're dead.
I know that it's like public healthcare in the UK. In the US, fortunately, I'm able to get healthcare through my parents, their jobs, but like I carry an EpiPen, and I know that like the cost of that has just been rising. So like there's like very few companies that even compete, so it's sort of like a monopoly for the EpiPen. Even though like we have insurance, it costs my parents about a couple hundred, even with insurance.
So 2 EpiPens. How much do you reckon they are?
$80.
600.
$40.
I'm afraid not.
More?
More.
$100.
More.
150.
More.
250.
More.
Shh. Shut the fridge.
More.
£300.
Double it.
$600. What? Why?
That's a very good question.
$600.
Yeah.
For me, it's more like just hives and shortness of breath. So it wouldn't be like an immediate death situation, but
$600. So how much would it be in Indian rupees? If $1,000 is 70,000 rupees, roughly ballpark. I think it's a little bit here and there. So how much did she say? $600. $500 would be 35,000. 100 will be 7,000. Right. So still quite high. Quite high. All right. 42,000 rupees. just
Like,
for an
so I've been
EpiPen.
fortunate I've not had to use it, but it's
Oh,
something
two
I keep on me.
EpiPens.
Like I have my backpack right now. I have it on me.
Cost of childbirth.
Jesus. 50 grand, something ridiculous.
Okay, this is comparable. I can compare how much it costs in India versus the US. I don't know. It's probably not a fair comparison, but I should still do it. India has decent medical infrastructure. I mean, if you get yourself treated in a private hospital, there are really good ones here. So okay, let me just quickly do that before he goes into that. I'm sorry, I'm having to stop this a little bit, but let me quickly do that first. Cost of child birth in India. Okay, it says 40,000 to 1 lakh. 1 lakh is basically 100,000. So yeah, 100,000, and I'd say okay, that may be a conservative estimate. So even if you get it done in a very nice hospital with all the bells and whistles, it'll still probably cost you maybe 4 times that, 5 times that, not more than that. So 500,000 Indian rupees. Okay, that's still pretty low. Okay, let's still do a comparison. And that is close to 7,000 rupees. Close to $7,000. It's happening to my math. So quite low, way lower than at least $10,000. So, and that's by the way me quadrupling it. In fact, making it 5 times.
Ridiculous now.
Yeah, see, I've blown the figures up on your head now, haven't I? Because they're larger. It's
Yeah.
the highest, generally speaking, is about 30 grand.
Okay.
Is that reasonable? You're happy
Not
with that?
reasonable at all. It's just like now we're on like we're on a
Yeah, yeah,
benchmark.
No, it's not. It's not reasonable.
100, 200?
Dollars.
Yeah.
The average is about
Isn't she cute?
10 grand. It can go up to 30,000.
10 grand for a baby.
Okay, that sounds wrong. 10 grand for a baby is never a good sentence. You should always qualify that.
Yeah, well, I guess. How much is your child worth?
Yeah. Well, is that like the same everywhere?
Yeah, the average is about $10,000. Yeah.
That's mad.
So that means yes, there are places where it costs less than $10,000. So we need to be fair to that section. But that also means half of that is above $10,000. So there's that too, and that is why the average is 10,000. Again, I don't need to explain you how averages work, but anyway, let's get on with it.
Mad. Oh, no thanks.
Okay, no thanks. In which case, the coil, IUD, contraception,
Yeah.
how much do you think that costs?
For one person to implant
No idea about it.
a grand?
Yeah, a little bit higher.
Really?
Yeah, $1,300.
Oh. Mental.
I wonder if you could tell me how expensive you think
Mental.
calling an ambulance out to your location is in America.
I guess it depends on like where you live. It really does. Okay.
Calling an ambulance, I'm not sure how much it costs here. Again, I don't want to go do a back and forth. I'll just play the video.
Is there a price for that?
Yes,
Jeez. $100, $200.
$2.5 grand.
For what? Why? Why?
Give birth by C-section,
Yeah.
and you would like to hold your baby after you've given birth to it.
Actually, yeah, that's what you do. Yeah. You have to pay to do that.
Yes.
Is hold the baby a code for something medical? I'm guessing that's what it is.
To hold my own child that I've been carrying inside of my womb.
Say something else.
Oh no, so it isn't. It's literally holding the baby. It's not a code for anything. Wow, they charge for that? Okay. I'm sure the charge is not that high for that.
But yes.
Jeez.
It's not actually that expensive.
Right. Charging me. I'm going to punch you.
Yeah.
Not you, but the doctor. Like
Don't punch a
$100.
doctor,
$40.
please.
$40.
They're just
For
doing
skin
their
on
job.
skin contact. What do you think of the NHS?
Literally the gift that keeps on giving. Literally. People are so dumb for taking advantage of it.
So there are
And
people who take advantage of it. Yeah.
I don't want it to change.
Fine, does it make you grateful for the NHS?
Absolutely. I mean, I didn't know how much free healthcare we got, like, just off the bat, but, like, knowing you have to pay, like, 30 grand for a child, it's outrageous. It really is ridiculous. So thank you, NHS, for your hard work.
I'm genuinely speechless.
Presumably you had an idea that healthcare was expensive in the US.
I didn't realise how expensive. Yeah, I'm just like, what? Like, if you don't have money, you're
Well, yeah,
you're fudged. Yeah.
What do you think of the people who are profiting off the sale of these medicines?
You're bastards. Sorry, beep. I think, yeah, I think they should be stopped. Fuck Trump.
Okay. That last bit was not required. I think that shows the little bit prejudice that media house has with conservatives. Again, anyway, this is another one, and this is the other version, the opposite version of Americans being told how NHS works and how they react to it. And I think there are both sides that they show. I watched 10 seconds of it, I must confess. And here we go. Trump Tower.
What do you think about socialized healthcare?
I do not like the idea of that.
I don't
Why
want
not?
the government picking what I can and cannot do.
Well, my husband's from Europe, so I think it's pretty good, actually. I think a lot of people are covered by it. Everybody's covered. They don't have to worry about paying for it.
It's definitely more accessible for everybody. It allows all of us to remain healthy, to live long lives as much as we can.
I think it's kind of a necessity that the government provides health care for its citizens.
If everybody has something for free, who's going to pay for it?
Okay, what if people pay for it by taxes? What do you think of that?
Well, that's going to increase. Do you like to pay taxes?
The national average payment is about $300 a month. Let's just take the upper value for it to be conservative. And that's how much? $7,100 is around 7,000 rupees, slightly more than that, but that's just for the ease of calculation. 7,000 rupees. 7 into 3, 21. Okay, so 21,000 rupees a month. A lot of Indians would be okay with it, actually. And they are talking about and definitely the median income of an Indian and the median income of an American or a UK citizen is quite different, right? So for them it should be even more affordable, and $300 a month for complete coverage is something that a lot of Indians would be okay with. Anyway, let's just get on with it. It is high for an Indian household though. Right?
So first of all, let me ask you, do you know what the NHS is?
No.
They regulate and provide national health services for the UK.
What do you think the average copay is under the NHS?
I can't imagine it goes any lower than 30.
Okay, so copay is something that you have to pay. Say you have to get a procedure done. I'm just trying to ensure that I understand what I'm watching. That is something you pay, that you have to pay, while the insurance also pays for your medical bills. That is the bare minimum that you still have to pay, I think. So I can't imagine it goes any lower than $30. Okay, I don't know about that. Let's see.
The amount for me is like $120
Quite high.
to see my family physician.
And what, so based on that, what would you guess would be the price there? Similar?
Probably, I would say probably higher.
It's actually, there isn't a copay, so it's $0. Do you know if you get healthcare if you're not a citizen, do you think, under the NHS?
If you're not a
Isn't there
citizen,
certain protections, but not all of them?
I'm guessing the way this is going on, it looks like it'll be covered for all.
You actually do get healthcare if you're not a citizen. What about if you're homeless?
Okay, that's a trick question because just because you're homeless doesn't mean you're not a citizen. So you'd be covered.
Yes. Correct. What about specialized costs, or specialized care, like an inhaler or an EpiPen?
In the UK, for inhaler or prescriptions, and I'm just guessing, at the most $20.
I'm guessing UK doesn't pay anything, which really sucks because we pay a lot.
I would say it's probably higher.
Considering what it costs here, I'm gonna ballpark that at also another 25-ish.
Okay, it's actually £9.
Just 9.
For any medication, which is about $12.
Okay, so they are cheaper.
So they are cheaper. What do you think of that?
I am still for individual medical care.
Wow. $10,000. Okay.
So have you ever avoided seeking health care or treatment or medication or any sort of health service because of the cost and you're worried about having to pay some sort of fee?
Yes, I have experienced
But
that a
without
lot
developing
with patients that come in with pneumonia but have been at home for a matter of 5 days and came in when it got worse and had to be admitted to the hospital. And we're like, why didn't you come in sooner? Well, I couldn't afford this bill, so I was trying to take care of myself at home first.
Even just
Okay. I hate to have to stop this video so many times, but just a thought that on so many things we look up to you, the developed world, right? We in many of the metrics we want to get to where you are. But if a developed country can't provide its citizens medical care for all, then what's the point of being a developed country? No, I don't get it. This may be call it my liberal bias. I'm not liberal on all things, but this seems a bit. And there's a point from the other side as well. The other side says, not the points so far that have been mentioned, but the other side also says that if you reduce the free market nature of how the medical industry goes on about its business, then it'll lose its competitiveness. If it loses competitiveness, then it'll lose inventions. And if it loses that, then medical science stagnates. That's what the other side says, which is not completely something you can refute. You still have to keep the competitive spirit alive, and you'll have to figure out a way to do that. But apart from that one factor, I don't think there's anything else that supports not having what they are calling a socialized medicine. I think on some sectors you can have it. It's could be a mixed economy. You don't have to be a completely socialistic economy. You could adopt the best practices from both worlds. At least because health, if you make that socialized, then that means people get to live. That's people's lives at stake. Anyway, I'm going at a rant here. I really need to stop, and I'm sorry. I apologize. I'll just get on with the video.
At school, I know people who, let's say, don't have the student health insurance plan, won't go get, let's say, like contraception or things like that because they don't really want to pay for it out of pocket.
I found out later that I had sprained my ACL. I couldn't move, but I also didn't want to call an ambulance.
She sounded
so I
like
couldn't
the
afford it.
girls.
So what'd you do?
I got on my friend's back.
But my sister, she has like a lot of allergies, so like instead of like using the ambulance for her like anaphylactic allergies, we had to drive her, which is very scary because you know you don't know about like traffic or anything. You don't have the same privileges as an ambulance on the road.
Have you ever not sought treatment because you're afraid of a cost?
No, ma'am.
Do you know anyone who has?
No, ma'am.
What about people who are afraid of the cost of, say, an ambulance?
Okay, that happens all the time because we have so many Americans that don't want to go in debt and they're trying to save money and they think they can go buy a car instead of an ambulance.
Looks like it.
So what would you think if that service was free?
If that service was free, anything that's free, sometimes it's not worth having.
Okay. It's not free. Paying a tax for it. So it's not free. Everyone's paying that tax. So that in the eventuality, in the future, if you fall sick, you get the service. Right? So it's not free. Who says it's free? So there are two arguments. The gentleman, there was a pretty animated gentleman earlier in the video who was saying, who's going to pay for it? That means it's not free. This lady is saying if anything's free, it's not worth having. So which is it? Either it's free or it's not. Anyway, it's not free, but it's just that you're going to pay less because the money is evenly distributed in the citizens. So no one takes the burden of the medical cost, like higher burden of the medical cost. Anyway. If you do percentage of the usually report problems with getting patient meds, or treatments because of coverage restrictions, okay? Only 15% of doctors feel the same.
77% of people in Britain support
why
the
wouldn't
NHS
they?
and are happy
Why
with it.
wouldn't
Would you say that you are happy with the United States healthcare system?
No, definitely not.
No, and I'm actually pretty lucky because I work for the university, so my insurance is pretty good, and even then I'm not happy with it.
That's a loaded question. I have insurance, and it's good insurance through my husband's company, but we pay through the nose for it. If it were free, I would love that. And if we only paid $350 a month, that would be a huge deal.
I don't believe that our government should be responsible for providing all of us health care. I think the individuals need to be responsible.
What is the
They
government
need
for?
to have a job. They need to look for jobs that provide benefits.
There's so many
disagree.
people,
I don't
especially people from sort of like
that.
lower socioeconomic backgrounds who can't get the health care that they need because they just can't afford it.
I'm really having a tough time taking her seriously. I'm sorry, but it's just that her voice is a bit. It's the voice that the comedians usually make fun of when they're referring to teenage girls. So it's a little difficult taking her seriously, but she's making good points.
The premiums are still pretty high. They're not unreasonable, but they're still pretty high. The medicine I have to pay for is not covered that much, and it's not even anything crazy. It's literally allergy medicine. And I still have to pay a fair amount every month for just allergies.
People are more than numbers, and they're more than, the change that you make from, stiffing people out of their health care.
Okay, I'm not going to be doing a lot of social commentary here. I think I've done whatever I needed to. Sorry for my rant earlier, but I felt passionately about it, so I expressed myself. I hope you're okay with it. It's fine if you're on either side of the aisle. It's just something that came up, so I thought I should react to it. What do you think about the US uh, medical system overall, and how expensive or inexpensive it is, and what kind of medical system would you like to have. I think this was also a big presidential debate topic, wasn't it? So what do you think? Let me know in the comments, and if you like the video, share your love. Right, bye.